colleagues and friends. In the next couple of minutes, I'll try and answer some of the queries, common questions regarding the current pandemic. So COVID-19 is a segmented positive sense RNA virus. It's part of the corona family viruses, which has another 4 common cold viruses, plus the SARS and the MERS viruses that caused epidemics in the past. What's the infection rate in the mode? Infection rate is reflected by the ascertainment rate, which is 2.5 to 3 for COVID-19, and this is quite significant. To compare it with example with flu, the usual ascertainment is 1.2. It can spread by large droplets, but that's usually limited to about 1.5 to 2 meters. After that, the droplets will fall on different surfaces. Other methods of spread is by aerosol generated procedures, so hence can be airborne for longer periods, and therefore healthcare professionals performing these procedures on patients need to wear the N95 masks. The other, which is the most common way of transmission, is through the format to face. So if you touch any infected surface and then you touch your mucous membrane or face, you can transmit it directly by touch, which is usually the more common method of transmission. What's the mortality rate compared to flu? Not very clear yet on the figures. There's some conflicting results and of different studies and different regions, but the rate is on average 1 to 3%. This figure can be high in pandemic centers like Wuhan in Italy, but the difficulty that the denominator is not very well defined. What's the long-term effects on the lungs of recovering patients? So the main pathophysiological changes in the lung related to binding to the ACE2 receptors in the alveoli and causing a direct damage to the hyaline membrane, giving a bilateral pulmonary edema and ARDS-like picture. And hence it causes direct damage to the lung. Patients that survive ARDS illness will have a reduced quality of life and exercise limitation up to 5 years after the illness. Obviously, we don't have data yet to show us what the COVID-19 long-term outcome is going to be, but I can't see it's different from this group of patients. What are the current treatments and medications? So we don't have any evidence for any antiviral treatment that's effective at the moment, but there are randomized controlled trials ongoing. Possibly the most commonly used antiviral treatment is a combination of an HIV drug, which is lopinavir, ritonavir, plus ribavirin. So other treatments are chloroquine, and these are some promising reports coming from China of good clinical outcome for some patients using chloroquine. The other main treatment will be supportive provided by intensive care, which include organ support and the usual management of intensive care patients. Is there any prospect of vaccination and anti-serum? There is a potential vaccination that's possible going to go to human trials, not sure, maybe in May or June, so no definitive vaccination. But if available for wider use, it will unlikely be available before summer 2020 or even 2021. What's the national immunity after catching the virus? So the UK government is trying to introduce that, which is called the herd immunity. So introducing the virus at different steps and try and delay it to protect the most vulnerable, because in order to protect the majority of the society, you're going to need to have a 60% immunity in the society. And with the ascertainment rate, which is higher for COVID-19, you maybe need to have a 80% immunity. There isn't only one case report of a reinfection with COVID-19 that I'm aware of. Thanks for listening. I hope I hope this answers some of your questions, and I hope we can keep you updated as the situation develops. Thank you.